If I may, healthcare is an issue near and dear to my heart. And, you know, while I strongly oppose Obamacare, at the end of the day, from a strictly dollars and cents purposes, and I say this as an employer of about 100 people, Obamacare is going to save me money. You know, the fines that I'm going to pay under Obamacare are cheaper than health care premiums in the state of New Hampshire. Now, health insurance premiums in the state of New Hampshire are as high as they are. They're the
highest in the nation.
Do you know why they're the highest in the nation?
Because we have the highest number of uninsured people, the highest number of obesity, the highest number of alcoholics and smokers.
But we also pay the least on a Medicaid standpoint.
Right.
We have one of the highest cost structures in the state of New Hampshire, and Health and Human Services doesn't really pay under Medicaid. It pays, what, like 1/6 of what Medicare pays. And so what the state's effectively done is it's a devil's bargain they've made. They've said, we're not going to pay anything to balance the budget, but what we're really doing is shifting costs onto all the small employers, because Walmart buys their insurance nationwide. So, you know, it's opening up the market and deregulating it will help ultimately, but the big issue is if you're not paying on the state side, if you're not paying on the Medicaid side. So how do you fix that? Where do you come up with the money to solve that?
And you made a very good point. I mean, you understand what he's saying. If you look at the hospital's budget, 50% of the income is generated from government-paid programs, Medicare and Medicaid, and the Obamacare is going to lower the payments, the funding of Medicare by $500 billion over the next 10 years. So you're going to get less reimbursement on that side of your balance sheet or income statement. That means you got to make it up on the private side. The less money we get from government, the more we need to raise from the private sector in order to balance a hospital's budget. Or a provider's budget if it's a doctor's office and so forth. You know, there's no easy solution here, and it's going to have to take some folks looking at managed care models, which we're trying to do in New Hampshire for one, you know, to help again manage the provision of care and on the public side. And also increasing to the extent we can our reimbursement rates under our Medicaid program. No easy solution. I'll tell you what though, one of the things we can't be doing is taxing our hospitals, which is what we do. We've collected this year a Medicaid enhancement tax from the hospitals and not funded the disproportionate share, which means we're taking more money out of the hospitals and there's less money available to provide care. It puts them in a deficit position. We need to eliminate that Medicaid enhancement tax, and I certainly will work to that end. Multifaceted approach, but we need people to get involved with this issue on a state level.
GrokTV.